Bro, I got a urologist.
I know.
We secured a urologist for this. I don't know why he's late.
It's weird.
What's he going to talk about?
I'm not even sure.
Sorry, guys. Sorry about
There he
being late.
is.
I apologize for that. Had a little emergency last night.
Okay.
Not personally.
Okay.
It was a medical emergency.
Urology emergency. Tell us about a urology emergency.
Well, for one thing, the reason I went into urology, besides
Because of no emergencies?
well, actually, lifestyle is a big factor.
Sure.
So when I was choosing my specialty, I knew I wanted to be surgeon.
Okay.
And then I said, well, lifestyle is important too. So what's something where you don't have to come in at night a lot? And urology is one of those, except for one big emergency, and that is called testicular torsion.
Okay.
So last night, I was called in at about midnight.
Yep.
Got a phone call. There's a 22-year-old in the emergency department, and he came in because he had acute onset of very bad pain in his right testicle.
Okay.
And you know what that almost always means?
Testicular torsion.
No.
Oh.
But that's the one thing that should always be kept in mind, because that is the most dangerous thing. Because if you have torsion, so torsion is twisting of the testicle on its cord. So think of this as being the testicle, this is the cord, and this can twist. And as this twists, it can block the blood supply, and that testicle, if it's not untwisted within about 6 hours, it will die and have to be removed.
Wow.
Half our viewers are squirming right now. We have to figure out more about this testicular torsion.
Okay.
Testicular torsion, who does it happen to? Why does it happen? And how do we treat it?
Okay.
So the testicles in the majority of males are, again, I'm going to use these, I don't have a drawing, but if these are the testicles on their cords, normally there's little attachments inside the scrotum that prevent these from twisting around.
Like little tethers.
Yes.
Okay.
Now, in some men, or some boys, males, the testicles do not have any attachments, and they're free to move around. So in the old days, they used to call this a bell clapper deformity, because in the bells that ring,
Yeah.
so that's a bell clapper.
Ah.
So if there's no attachments, these things can twist, and if they twist too much, it blocks the blood supply. The testicle comes up, it goes on its side, and it hurts like heck.
Okay.
So it's very important that as soon as you get testicular pain, especially if it's acute onset, that you get it checked.
So just back to your previous question, is the number one cause of acute severe pain epididymitis then, not testicular torsion?
Most of the time it is. Now,
Okay.
the important thing is the acuity. So you can get pain in the testicle. Usually with epididymitis, it's a little bit more gradual. So epididymitis is an inflammation or infection of the drainage sac on the side of the testicle where the sperm is stored. And that can get inflamed, infected, and that can happen in a rather fast fashion, but it's usually not as sudden as in torsion. But don't try to figure it out at home, because
Honey, can you check this? No, that's not the kind of
you
thing.
don't want to miss. You don't want to miss a torsion, because you've got, once it's twisted and the blood supply is cut off, you've got about 4 to 6 hours to get it untwisted.
So it's really the vessel, it's not the nerve, it's the blood supply to the testicle that's the problem.
That's
or
right.
else 4 to 6 hours to untwist that testicle, or else
it becomes ischemic and necrotic. So the tissue actually starts to die, and there's a point where it's irreversible. So if we get in there and untwist it, we watch it and we wait to see if it reperfuses and whether the blood supply comes back. There's a point where if it's blocked off, the blood coagulates. Even if you untwist it, the blood supply does not come back, and it has to be removed.
Okay, so testicular torsion is a urologic emergency, one of the rare emergencies you guys have, I suspect. And you have to treat it urgently, otherwise the consequences could be a loss of that testicle.
That's right.
Public service announcement.
Yeah, for sure. And you said it can happen to any age, but typically it's going to happen in someone that's on the younger side?
What happens during puberty, the testicle enlarges.
Okay.
So you've got a bigger mass again. If your testicle gets bigger, there's more of it to sort of move around, and that is a factor in torsion occurring more often around the time of puberty. However, it can happen in very young children, and it can happen in older adults.
And do you have to have the bell clapper deformity for this to occur, or can it occur with anybody?
Yeah, it has to be able to do that twisting.
Okay, and what percentage of the population, of the male population, has that deformity, if you had to guess?
Good question. I actually don't know.
Okay.
Okay.
Anyone who
Thankfully,
looks
it's a small percentage, or I'd be in here every night.
that up? Okay.
If you had an experience with this, obviously leave a comment. So now you've got the severe pain, you go to the ER. You don't go to your family doctor, you go to the ER.
You go into the ER, yeah.
They quickly assess it, then they quickly call you. What is the treatment? So how does it look? So you go up to the operating room, you go to sleep,
Yes.
okay?
Basically, I get a call from the emerg doc, and like last night, he didn't even say hello. He goes, Peter, we've got a torsion.
That's it.
And then we know what to do. I call the charge nurse gets the whole team in, and we have an excellent team here, and they had everyone in here within 20 minutes, and we started operating within half an hour of that phone call.
Okay.
And he's going to be a happy gentleman because we got it untwisted. It looked like it reperfused nicely, and that testicle was saved.
Where's the incision made, Peter? Like how's it actually done?
So the important thing is, once there's a torsion, the other side is going to be also prone to getting twisted because it also doesn't have that tether.
Okay.
So we make a midline incision in the middle part of the scrotum because what we have to do is, first of all, we untwist the torsion, and then we have to watch it to make sure that the blood supply comes back, and then we have to put sutures in, little sutures into the testicle, 3 or 4 sutures on each side so that it can't twist in the future.
So prevent it from happening
And you
again.
have to do it on both sides because you don't want it to happen to either side.
Okay. And then they go home next day?
Yeah, usually you're going to go home the same day. And the important thing I want to point out, if you're in the unfortunate situation where that torsion happened and the testicle is lost,
Yep.
just remember one thing.
You have another one.
There's another one. So with one testicle, that's all you need to produce enough testosterone that you won't change any of your, you're still going to be able to grow a beard if you had one before. You'll still have that deep voice. And one testicle is all you need to produce millions and millions of sperm to have many, many children if that's what you desire.
Okay.
Always good to have a spare testicle, but if you lose one, you're still good and you can still carry on.
That's right.
That is awesome information. So now you know if you have a testicular emergency, go straight to the ER. It might be testicular torsion. If you like this video, please like and subscribe to our channel.
And remember, you are in charge of your own health and your own testicles. Thank you, Peter.
You're welcome.
See you next time.